My name is Charl Els and I'm a clinical professor in the Department of Psychiatry, and I'm appointed as a physician educator in the Division of Preventive Medicine, Department of Medicine at the University of Alberta. This session focuses on the occupational impact of idiopathic environmental intolerance, or IEI. It also has been referred to as multiple chemical sensitivities, a term that's no longer used, or environmental hypersensitivity. Thank you to the Workers' Compensation Board of Alberta for making funding available for this project. There are no conflicts of interest to declare. The opinions expressed in this presentation reflect those of the speaker and not necessarily those of any collaborator or project sponsor. The session provides a brief overview of the features of idiopathic environmental intolerance, including causation, prevalence, diagnosis, treatment, and prognosis. And it addresses the occupational impact in particular, namely capacity, risk, and tolerance. At the end of the session, participants will be equipped to recognize IEI as an occupationally relevant medical condition, describe the impact on the variables, and thirdly, broadly outline evidence-based interventions to achieve maximum medical improvement. So what is idiopathic environmental intolerance? The essence of this condition is the presence of recurrent, non-specific, medically unexplained symptoms occurring in response to exposure to a variety of chemically unrelated compounds at doses far below those established in the general population to cause harmful effects, and for which no single widely accepted test of physiological functioning can be shown to correlate with symptoms. Usually there's a history of exposure to some substance in the person's environment, and it can be perfumes, food additives, food, fabric, secondhand tobacco smoke, exhaust fumes, carpets, new and old carpets, furniture, copy machines, preservatives, chlorinated drinking water, household cleaners, pesticides. The list is actually infinite. There's a frequent observation that there's no dose-response relationship, and persons often avoid or try to avoid known triggers. So what causes this condition? Well, it's unknown. Persons with idiopathic environmental intolerance typically complain of non-specific symptoms resulting from the exposure to low levels of these chemical or biological or physical substances, and as said, paradoxically, exposure to high levels of substances associated with the insensitivity may not replicate these symptoms that previously appeared at much lower levels. What we do know that it's likely not an immunological condition, neither is it a respiratory disorder. Psychiatric factors do play a significant role in the development and perpetuation of this condition. Some individuals suffer from psychiatric illnesses that may precede the onset of this condition. There's no evidence to support the theory that idiopathic environmental intolerance causes psychiatric disorders. How common is it? Well, it's unknown. The exact prevalence is uncertain. We do know it's more common in married women. The diagnosis is made by taking a comprehensive history and performing a physical exam, which is usually non-contributory. Physiological and psychological evaluation often useful. Psychological evaluation is to detect concurrent psychopathology or any diagnosable condition. There are no specific tests or specific investigations either to diagnose idiopathic environmental intolerance, which is often one of exclusion, and that's based on self-report. What we do know is that there's a number of tests that are not useful. For example, hair testing for heavy metals, provocation, neutralization testing, chemical and food challenges, immunological testing, inhalant challenges, serological testing, Epstein-Barr virus antibodies or autoantibodies, blood testing for organic hydrocarbons and pesticides, and so on. Looking at the impact on the ability to work, risk, capacity, and tolerance. Well, tolerance may be the predominant issue, and that impacts the ability to work. Persons with idiopathic environmental intolerance don't typically have objective medical evidence of their symptoms, and the self-reported symptoms are, as suggested, usually associated with normal physical examination, in other words, an intact capacity, and no abnormalities in diagnostic tests. So the occupational physician usually has little medical basis to suggest limitations or restrictions, and it frequently leaves the individual with no duty to accommodate, it is a significant challenge. Of note, accommodations are often not necessary with this condition, and cases are decided on individual basis. Unless there's a psychiatric condition incurring additional risk, there's no known risk for the individual with idiopathic environmental intolerance, no risk to his or her co-workers in working with this disorder. Similarly, occupational capacity is not affected by this disorder as said. It's however not uncommon for workers diagnosed with this condition to complain of cognitive symptoms, which they may then consider as impacting their perceived ability to work. The person may implement restrictive behavior to avoid the particular trigger that's also impacting their ability. The self-limitation in work and social activities include avoiding driving, shopping, wearing certain types of clothing, eating in restaurants, entering certain office buildings or workplaces. As suggested, the occupational risk is not usually disproportionately elevated, and occupational capacity also usually intact. There often exists no objective medical foundation to support restrictions and limitations, and the tolerance remains the main issue. For treatment, there's no known treatment for this condition, and most of those suffering from this condition do not seek treatment. Persons with this condition often display psychopathology, may even reach the threshold of a diagnosable psychiatric condition. For example, a mood disorder, an anxiety disorder that does warrant independent management. There are no proven or effective treatments for idiopathic environmental intolerance, and cognitive therapies and the relaxation therapy may be of benefit, as well as psychoeducation and supportive therapy. There are therapies that may be harmful that should be avoided. Symptomatic improvement can be achieved in some individuals with this condition by chemical avoidance and creating a chemical-free living space. Some intolerances that are lumped under idiopathic environmental intolerance may actually have a genuine organic as opposed to a psychiatric origin or cause, which however can be challenging to prove. For example, scent-induced migraine, some allergic phenomena, which cannot always be ruled out by testing. Allergy tests are available for some, but not for all potential allergens. So in practice, a patient with a sensitivity issue may actually be helped by avoidance for some. Also, specific avoidance aside, scent-free workplaces are now fairly common. Unconventional modalities such as transpersonal approaches, prayer, meditation, acupressure may be of benefit, and often referral to a psychiatrist is useful, and it's usually indicated. The condition is usually chronic in nature and the prognosis is uncertain. The long-term outcomes are not known, but care should be taken to rule out comorbid conditions and to address any complications. And these complications often arise from the individual's self-limitation in behavior. Idiopathic environmental intolerance is a condition of unknown etiology and prevalence. The occupational tolerance is a predominant issue as opposed to capacity and risk, and no known treatment is available. Oftentimes, avoidance is the mainstay. For further information on additional sessions of this nature, please have a look at the website of the division, and we look forward to your feedback and comments, and please help us identify further topics for future discussion. Thank you.